Oh my God, my favorite subject, GLP-1. So yes, of course, we're using them for weight loss, but there's just so much more to the GLP-1 picture. When we talk about GLP-1s, we talk about insulin resistance and insulin sensitivity, which has always been a super hot topic, but we haven't really been able to address it with any meds. GLPs are around for about 10 years, but in the last 3 or 4 years, it's becoming increasingly clear that by improving insulin sensitivity, we also then help people lose weight. But it does more than that, because insulin sensitivity is also tied up with inflammation, and that is the source of chronic disease, not just diabetes, but neuroinflammation, and cancer, and many other downstream effects. So we have about a third of our patients on GLPs, and we've lost about 3,500 pounds cumulatively. What we can't quantify is sort of reduction in their chronic disease moving forward. So in our practice, when we prescribe GLPs, almost universally tirzepatide to our patients, we see them back monthly, and we see them both for weight checks, but also for body fat analyses, because one of the concerns with these meds is that it can pull off muscle relative to fat. And we do see that in a small percentage of patients, but we want to make sure that if you're one of those patients, that we don't continue using the med. And we do that by monitoring their body fat routinely. Another incredibly satisfying area of our practice is in postmenopausal, postandropausal hormone replacement. It's one of the areas that's particularly satisfying because it's a quality of life issue. When you prescribe hormones to those that are hormone deficient, universally you hear about improvements in quality of life that you can get with almost no other substance. So we're talking about increased energy, increased libido, increased mojo, improved body fat, reduced strength, or increased strength, better sleep, things that you can't achieve with almost anything else. And we can do it safely, and we can do it for long periods of time. Yeah, so we will always check your labs at baseline to make sure that you are in fact deficient of whatever hormone that it is that we're wanting to prescribe. We always start low, we look out for side effects, and we measure the labs as we go to make sure that we have the optimal dose. So we've always started with primary care. That's our bread and butter, and so that began in 2003, and we built our primary care practice. But we recognized that being downtown, and with there being really limited resources downtown, but a huge tourist and residential community here that were not our members, that there was a need for urgent care. And so in 2016, we began our urgent care next door, and in our urgent care we see both those from the community, but also our own retainer patients, our membership patients, as urgent issues arise. We have 3 amazing mid-level providers there. The feedback has been amazing, and they can handle things real time. You almost never have to wait more than half an hour to be seen. Then a few years ago, recognizing that our patients were going elsewhere for their aesthetics procedures, we brought that in-house with Botox and fillers and microneedling. Now we're using our Shockwave for skin tightening, and we have quite a few modalities that we're using in our aesthetics practice. But the 3 practices really kind of are synergistic in their approach, and many of our patients appreciate having one place to come for all of that.